This PowerPoint presentation discusses a few ethical considerations that are important when one is involved in working with the community. The learning objectives for this PowerPoint include to define the ethical principles of non-maleficence and beneficence for health professions, describe the ethics inherent in the core functions of public health nursing, and apply the ethics of advocacy to nursing practice in the community. Two important ethical principles that I would like you to know about are non-maleficence and beneficence. And these apply to us as nurses wherever we are working. Health professionals with non-maleficence act according to standards of care, always seeking to produce the least harm possible. We do not want to cause more pain and suffering for our patients. We want to, whatever treatments we are giving, be assured that they are not going to be harmed by those treatments. Beneficence, health professionals' obligations to perform those actions that maintain or enhance dignity, whenever those actions do not place an undue burden on healthcare providers. So that is really about treating all of our patients and our coworkers with respect and dignity. And when these ethical principles are followed, we usually will have very good patient outcomes. Relating to the core functions of public health, when you think about assessments, we have to think about qualifications and preparation of the people collecting the data. Second, the assurance. Are care providers in the community competent and available? The third, policy development. Do we have leaders that support the health of the population rather than personal or political interests? I think that's a very interesting one right now, because I think within the political arena, I'm not sure that we have politicians that are always supporting the health of the people. If you look at the Affordable Health Care Act, Obamacare, it certainly does benefit some people, but given the monies that have been taken away from Medicare to support the people who need insurance, it is actually hurting the older population. So, ethics, very important. A couple of examples here. Ethics, it's not a black and white thing. It's always a very difficult thing, no matter what setting that you were working in. When I was a new nurse working in pediatrics, I very quickly got involved in the ethics committee because of some issues that we had with children with congenital defects and cancer, and issues about treatment and should they be treated, what about the parents' wishes, their religious practices, cultural practices. It gets very dicey. It's not black and white at all. I think it was last year or so, we had a problem with the blood samples for testing for illegal substances. They were done. The last thing I want to talk about is ethical principles for advocacy. And here we're thinking about advocacy in terms of the client being the community. So acting in the community's best interest, acting in accordance with the community's wishes and instructions, keeping people in the community properly informed of what's going on, carrying out instructions with diligence and competence, acting impartially and offer frank, independent advice, and maintaining confidentiality. So if you think about this in relation to a bioterrorism attack, for example, and a smallpox vaccination site needs to be set up, people need to be informed about that, where to go to get the vaccination, what the risks are of getting the vaccination and not getting the vaccination. Instructions need to be carried out that the vaccine needs to be given properly. People need to be given the right information. And last, certainly who's getting it and who's not getting it, confidentiality should be maintained. Some other thoughts as I was preparing this PowerPoint. I thought about the media, and when there is a bioterrorism attack or any kind of terrorism attack, does the media focus more on individual experiences rather than giving us the facts that we need to know? How about distribution of funds for health care? Are monies being targeted for the right programs? What about the recent issues with DCF, with the children being harmed or killed? Is DCF being funded properly? What about older adults taking a driving test? Should that be required, or is that infringing on their rights? In reality, more accidents occur with inexperienced drivers. Another hot topic, should healthcare workers be required to have the flu vaccine? There's been issues with, in particular, nurses refusing to get the flu vaccine and suffering the consequences even of losing their job. Can a facility force us to do something that our conscience says, no, that's not accordance with our personal beliefs? So that's another issue there as well. So ethics, always important to be considering ethics, whether we're doing individual patient care or care in the community.